What's going on, guys, and welcome back to the channel. I'm Zach, and today we're bringing over some Naplex stuff. So tobacco cessation is the topic of the day. But before we get into that, let's tell you about the channel. So on this channel we go over some medical topics, go over some pre-med topics such as like how to apply to medical schools, how to go about picking a school, some interview tips, and etc. The list goes on and on. So let's get into this topic today, which is the Naplex tobacco cessation stuff, and pretty much everything you need to know about this. So first up, you have nicotine replacement therapy, so which is NRT, and for this you have a decent amount of stuff that can happen. So you must be at least 18 years or older for this, and combo therapy is the most effective. Now this is the general rule of thumb, yet in some real life scenarios you can actually see 13-year-olds to get Nicoderm and gum and lozenge. So this isn't a hard fast rule for you guys who think this is. This is just the general consensus on what happens in life. So the patch is called Nicoderm. If you smoke more than 10 cigarettes a day, then you use a 21 milligram patch. Less than 10, you use the 14 milligram patch. That's really important to know. So 10 greater than 10 cigs, 21 milligrams. Less than 10, 14 milligrams. Main side effects is vivid dreams. So what do I mean by vivid dreams? So vivid dreams can be anywhere from, hey, I'm in a town and now there's this big giant dinosaur green thing chasing me around the town trying to eat me. That's what I mean. And this is a pretty common side effect, so this is actually one of the main reasons why people don't actually quit smoking. Because one, the patch is actually one of the more affordable options and it works really well. Because you should combine that with the gum and lozenge for pretty good combo therapy. But these side effects of the dreams really makes people not want to use it. Like they hate going to bed at night because of this. So that's something to keep in mind when counseling patients on the patch. The gum and lozenge. So if you're doing your first cigarette within greater than 30 minutes of waking up, use it 2 milligrams, and less than 30 minutes, 4 milligrams. Again, dosing is really important for NRT therapy and for the Naplex. To make sure you know that. You want to have at least 9 pieces a day for the first 6 weeks, max 24 for gum, and max 20 a day for lozenge. And for the gum and lozenge, don't eat or drink 15 minutes before or during use. And there's also an inhaler and nasal. You want to avoid those in COPD or asthma. So you want to chew slowly. This is probably not on the Naplex, but it is important to know for counseling purposes. Chew slowly. Stop chewing the gum when you get a peppery tingly taste. Part between your cheek and gum, and chew gum in the tingle phase. Okay. This is some important counseling information you need to tell your patients. Bupropion, so this is actually a depression medication as well, which is called Wellbutrin. Zyban is the one that was marketed for smoking cessation. I'm gonna use it about 1 week before your quit date, so you can start getting used to it. It has use 150 milligrams once a day in the morning for 3 days, and then you increase it to 150 BID. Max dose is 300 milligrams per day for 6 months. Has a BBW or black box warning for suicide risk. Also, contraindication and seizures. That's because it lowers the seizure threshold. Anorexia history causes weight loss, so don't use it there. And it interacts with MAOIs, linase and methylene blue, causes serotonin syndrome. And then it also causes dry mouth, insomnia, and weight loss. Chantix, abnormal dreams. Take after eating with a full glass of water to lower nausea. That's really about it. Worry about weight gain? Don't use the worry about weight gain. Use gum, lozenge, or bupropion. Depression with smoking cessation, bupropion. Denture work or any early dental work, avoid the gum. You have asthma or COPD, avoid inhaler or spray. You have a skin condition, don't put anything on your skin, so avoid the patch. You have seizures, Well, avoid chances and prepare on. Cost is the biggest issue? Well, you're probably going to be stuck with the patch and the gum or lozenge. To summarize it, there's those on the screen that we just talked about in 2 seconds. That's really it, guys. I mean, it's a pretty simple topic, but really knowing those things of everything and when to use everything is really important. So, if you guys learned something, comment below. Thank you.